In this video, we're going to learn about joint and ligament injuries and intervention of the injuries. Before that, do you know what is joint and ligament? Joint is the part of the body where two or more bones meet to allow movement. There are three classes of joint. First, freely movable joints, which ball and socket joint, plain joint, and condyle joint. Other freely movable joints are hinge joint, pivot joint, and saddle joint. Second class of joint is slightly movable joint that can be found in vertebrae of the spine, and third class of the joint is immovable joint, are sutures found between the bones of the skull. What is ligament? Ligaments are bands of tough elastic tissue around joints. The ligaments connect bone to bone and give joint support and limit their movement. Then, what is joint and ligament injuries? Joint injury occur when the ligaments surrounding the joint stretch or tear. Then, ligament injuries occur when there is an abnormal transmission of forces through the joint, resulting in damage to other structures in and around the joint.
Prevalence for joint injuries. In the US, severe joint pain is more common among adults with arthritis that also have underlying conditions, and until 2014, severe joint pain happened to women more than men and occurs mostly in adults aged 46 to 65. Meanwhile, for ligament injuries, about 150,000 ACL injuries occur every year, and young women who play high-intensity sports are 2 to 8 times more likely to suffer from ACL injuries than young men. What are the clinical features for joint and ligament injuries? Well, the individuals will experience joint swelling, feel pain when walking or standing, joint stiffness, limited range of motion at the affected area, noticeable deformity, warm feel at the joint, weakness, and loud pop or popping sensation at the affected area. According to ICF, joint and ligament injuries can bring impairment to the body structure and function, such as limited range of motion, poor muscle strength, noticeable deformity, swelling, joint stiffness, limb pain, and weakness. This impairment can bring limitation to the activity that makes the patient unable to perform ADL, leisure, and work-related activity independently. Also, the patient will feel restricted in participating the role as a family members, friends, colleagues, and also community members. These factors can also affect the prognosis of the injury, such as environmental factors like work and home environment, health services and support system, also personal factors like age, gender, motivation, lifestyle, and habits.
Next is frame of reference, a combination of biomechanical FOR and rehabilitative FOR is used. BFOR focuses on treating impairment in which client factors such as range of motion, strength, and sensory function will improve the performing level of an individual. Then, rehabilitative FOR RFOR is focusing on the functioning of the individual, like as a worker, back to society, and independence in daily living activity. What is intervention for joint and ligament injuries? First one is continuous passive motion, CPM. CPM is one of the medical devices that used after surgery to help in produce passive joint motion and to alleviate joint stiffness. CPM also used to encourage a range of motion to reduce muscle atrophy and to stimulate tissue remodeling and regrowth of healing tissue such as ligaments. According to Harvard LA et al. 2014, CPM does not have clinically important effects on active knee flexion ROM, pain, function, or quality of life. However, it is believed CPM increases the recovery of knee ROM and has other therapeutic benefits. Secondly is splinting. Splinting is a rigid or flexible device that promotes immobilization of affected part, support to promote healing as a pain relief and restoring or maintaining of ROM. This is example of splint. First, knee immobilizer splint, ankle stirrup splint, and lastly splint to protect the MCP joint of the thumb after ligament injury. According to this study, braces and splints can immobilize and protect joints, reduce pain, decrease swelling, and facilitate the healing of acute injuries, then used for injury prevention and chronic pain reduction and alter the function of a joint.
The third intervention is range of motion activities. It is the type of movement or activity that aims to preserve flexibility and mobility of the joints on which it is performed. There are three types of ROM activities: AROM, PROM, and AAROM. The aims for this intervention is mainly to improve ROM at the affected area, to promote full mobility, to prevent stiffness, and to develop good coordination and motor skills for functional activities. Before starting any activities, make sure that the patient is in a comfortable position, provide explanations and guidance to the patient, and also supervise the patient throughout the activities. Procedure for PROM. The therapist gently holds and moves the patient's limbs and avoids painful area. The motion should be smooth, slow, and steady, with motion occurring by moving the distal limb with the proximal limb held steady. For AAROM, the therapist guides and assists the joint motion with the patient is supported by a sling. The joint motion is then being moved to some degree. For AROM, the patients perform the activities to expand motion and encourage more complete use of the full available ROM without the help from therapists. For each activity, gradually increase the duration of activity, repetition of movement, level of arc for shoulder arc activity, and level of ROM at the limb for stretching and pulley exercise. Millis and Levine 2014 stated that ROM activities are important to achieve improved motion of joints after acute injury or in patients with chronic conditions. They are also important to help increase flexibility, improve muscle and other soft tissue extensibility to help prevent further injury to joints, muscles, tendons, and ligaments. In conclusion, joint and ligament injuries are very common to occur in both men and women, especially in adults and older adults. The signs and symptoms for the injuries may reduce their productivity in performing daily life activities. Therefore, there are varieties of interventions that can be done to reduce the symptoms and help the client to live in a healthy lifestyle, which can increase their physical health and improve their quality of life. That's all from us. Thank you.